Leslie, can you hear me?
Yes, I can hear you, Janet.
Excellent, excellent.
Hello, Leslie. Leslie, did you know that there was another webinar going on right before this one? Marie
Oh,
was, yeah, Marie was doing a great job, calmly moderating that one.
Ladies, you're live,
Excellent.
and you have 13 guests.
I don't know how I was able to get on now, but somehow it let me in this time. I went to a different browser. I didn't think I was gonna be able to get on at all.
Hi,
Oh, good.
Leslie.
Hey,
How are
how's
you?
everybody? I'm good. How are you
Excellent.
all?
Hello, everyone, and welcome. We're going to get started in just a moment.
Hi, Marie.
I call her a magician now.
Yes.
Birth, birthing the magic magician. I love your new picture, Amina.
Thank you.
Very nice.
You don't look like a teenager anymore.
I
That's
know,
supposed to be a
right?
compliment.
I
Well, her
was,
other she looked like a teenager in her other picture.
I
She
know.
was so young.
And that wasn't even so long ago. Not
I
that.
know.
Live, Dr. Leslie.
She's directed that statement to me. What were you
Live.
saying, Marie?
You are live.
Yeah, I'm here.
Leslie Farrington, you're live.
Yes,
Oh.
I am here.
You are the moderator. You're
Very
welcome in the audience.
Oh, you made me the moderator? Aha. Well, I have greetings, everyone. I've just found out I'm the moderator. So I want to welcome you to our webinar on the different professionals that will be that are available to us when we get pregnant. And I will have us all introduce ourselves. I'm part of the program. I'll start us off. We have obstetrician here present. We have a midwife. We have a doula and perinatal mental health therapist. And we have a nurse and lactation professional. So we have all the perinatal specialists available for our conversation this evening. And so I'll start us off. I'm the obstetrician in the room. I'm a retired African American from an interracial family, obstetrician. And I like to tell people that an obstetrician's role in the birthing and prenatal and birthing process is to keep an eye on things and manage problems as they develop. So we evaluate the person's pregnancy early on to make sure that the pregnancy is developing inside the uterus and not in another location like in the tube, to make sure that it's growing and not becoming a miscarriage. So we watch out in the first trimester for those things. We do basic blood work, full exam, any tests that need to be done like pap smears and tests for sexually transmitted diseases. And then we watch, usually using sonograms if as needed for to see how the pregnancy is developing through the middle part of the pregnancy. The blood pressure is important. We're watching blood pressure to look out for things like preeclampsia which is high blood pressure in pregnancy. And that was one of the main reasons why prenatal care was started, is to watch out for preeclampsia and to save lives. So throughout the pregnancy, the heartbeat of the baby is checked, the blood pressure, the urine to see if there's any protein developing, which is another sign of preeclampsia, and basically just to see if that the person who is pregnant is coming along just fine, and then plan for delivery, or that's the way doctors refer to it, is delivery. So the obstetrician is the doctor who's watching out for any problems that develop, and they're there to catch the baby, which is what midwives usually say. Doctors say deliver, midwives say catch the baby, right, Janet?
Catch the baby or birth the baby.
Or birth the
assist
baby,
with
right.
the birth of the baby, yes.
Right. So since I've retired for a while now, so I've started saying give birth instead of deliver, because babies are not pizzas.
That's right.
But so for doctors manage the pregnancy, they manage birth, watching out for complications, and midwives have a different approach. So I'll let Janet take it from there.
Okay. Good evening, everyone. Thank you for joining us this evening on the Womb Chronicles. My name is Dr. Janet Williams. I am a certified nurse midwife, doctorate prepared. I've been a midwife for 19 years, and my journey to midwifery was not a straight path. I started as a nurse, and one thing that changed the transition in my career, I think, came when I went from in-hospital labor and delivery after being in intensive care unit and med-surg. I went into home care, and in the intimate setting of my clients' homes, I saw the impact that I could have on supporting patients in their own environments, and kind of a departure from clinical environments where policies sometimes overshadowed the individual preferences that clients had. So I looked at the two careers. I loved OB and I loved home care, and I loved being around the family and really getting to know them. And so basically there was an perfect intersection of my passion and my skills, and I wanted to empower women and their partners with knowledge and support to allow them to take ownership of their birth journeys and have confidence in their decisions and ability to birth. I found that birth is often placed into a box sometimes when it's in a hospital setting, and that's the way medical education had been up to that point. And they kind of put it in as an illness almost, and birth is not an illness. There are some complications that can come up, but that is the minority of the patients. The majority of women have low risk, healthy, safe deliveries, and so we should look at birth that way and monitor for the complications that can come up, but treat it as a joyful experience. Women shouldn't have to go into birth scared to death. That should not be the goal. So as a midwife, there are several different types of midwives, and we are healthcare providers, and we offer personalized expert care during pregnancy, childbirth, and after birth. CNMs are certified nurse midwives. CMs are certified midwives. We provide care to low-risk women during their pregnancy and even before. We do checkups. We do pre-conception counseling long before a woman is even pregnant. We give them information how to stay healthy during a pregnancy or before. We do routine GYN exams. We give primary care screening. We diagnose and treat things like STDs, urinary tract infections. We prescribe medication and provide contraception. So our scope of practice allows us to care for women from adolescence all the way to menopause. And the roles and scopes, unfortunately, in different states vary. So that's sometimes the confusion of what midwives can do depending on what states they're in. CMs are recognized at this time in 12 states. And then you have CPMs who are educated through an apprenticeship program versus the other program that the CNMs and CMs are associated with. And they have to have experience, and they do out of hospital births. So they do births in birth centers and in homes. And they provide a different scope of practice as they focus more on the pregnancy and childbirth. So that's just a little bit about what midwives do.
I'm
Leslie, we
sorry,
can't
I was
hear you.
muted.
Okay.
Yes, I know. So before we turn to Leslie and Amina, can you just mention the differences in what a midwife can do versus what a doctor, an obstetrician can do? Recognizing, of course, that um, the care of a midwife is looking towards a more holistic approach and not
Correct.
just watching out for problems.
Correct.
That's a big difference, I think, that
Yes.
doctors are not looking at birth as pregnancy and birth as a very natural process that is generally going to go fine. So tell us the other differences.
Okay, so just like doctors, midwives can care for women during pregnancy and birth. We can diagnose and treat illnesses, prescribe medications, perform procedures, and provide comprehensive medical and gynecological care. Doctors are doing surgeries. They do C-sections. Midwives can first assist in the surgeries, but we are not surgeons. The doctors are surgeons. We midwives provide low risk care for low risk women, and we can also collaborate with doctors and provide care with them for high risk women, which in a hospital setting, which I worked in, we could work together so the woman or the birthing person could have the benefit of having a physician and a midwife, which is an awesome combination. And that's an important thing, that doctors and midwives should be able to work collaboratively so that the patient gets all of the care they need. Midwives look at birth, like I said, as a family event. We want the woman to be up and moving. We don't want her just laying in a bed. We want the movement that helps the birth and that helps the labor progress. We want her to have all of the comforts of home, even if she's in a hospital setting, as many comforts of home, and have her family there. And we want to have her have this birth experience be something that's memorable and joyful. It shouldn't be like a medical procedure that she came in to deliver her baby. This is a birth. And when women deliver or birth their babies, that's going to be a memory they're going to have for the rest of their lives. So our job is to be there to do education. It's a lot of teaching we do as midwives. We want to give the woman all the information that she needs to make informed decisions. That is the whole idea about informed decisions, and the woman should be at the center of her care. It shouldn't be just standard procedures. This is how we do things. This is her birth, this is her baby, and her experience. And so we want to give her all of the information that she needs to make good decisions. And then we want to make sure that she's at the center of all of the plans that are made for her delivery and her pregnancy.
Thank you, Janet. And now we're going to move on to our other members of our birth team. Amina, why don't you tell us about the role of the doula, and then we're going to hear from Leslie about the real important topic of lactation. So, Amina.
Thank you so much, Leslie. So my favorite role among the many things that I do is my work as a doula. I consider myself a birth champion. I'm also work as a clinician, but my work as a doula sort of encompasses all of that because I believe in the right to a safe and a respectful birth. And all of what you deserve as a birthing person and as a human being when you're being cared for in the healthcare system. It's what's deserved by law and by morality. So as a doula and as a birth justice champion, it's my role to speak up for those who may feel less empowered to use their voice. I use my voice to help raise theirs. And so my work, while centering around birth and healthcare, is tied directly to social justice work, right? Doulas, we work from a perspective where our goal is to ensure respectful birth, or respectful care for patients. I remember hearing one of my mentors say that the fight for Black life starts at birth. And so once I heard that, I knew that the fight is deep, and then there was a need to get to the foundation, and it doesn't get any foundational than the mother. As a doula, my role is to be a part of your care team. Um, I provide a presence that helps to ensure that you're having a holistic birthing experience, that you're centering that your mind, your body, and your spirit is centered so that you can get individualized, culturally sensitive, and relevant care that and ensure that your voices are being heard and that your preferences and your concerns and your desires are being respected and honored. Um, Also, as a doula, my role is to provide education so that you can feel empowered to advocate for yourself, so that you can feel empowered to know what it is that you want and what it is that you don't want. And so I offer resources such as your rights as a patient, your patient's bill of rights. I offer resources that can help give you that holistic prenatal care that you deserve, right? So that in addition to getting medical care from your medical care providers, um, I may be able to connect you with other resources such as lactation consultants, nutritionists, childbirth education, CPR, prenatal fitness, mental health support, any resource that can provide that holistic level of care for you during this very transformative journey. Then there's the physical support. There's so many things that we do. There's the physical support, ensuring that you have what you need to make this journey, make that labor and delivery and pregnancy experience as 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 less uncomfortable as possible, right? Trying to ensure that we can alleviate some of your discomforts, and make you as relaxed as you can be, so that when it's time to give birth, your birth can go as smoothly as possible. And then what's most important to me as a doula is the continuity of care that's provided from doulas. Healthcare providers, they prioritize your health and safety for both you and your baby, and they may have limited time to provide emotional support or answer non-medical questions. And so a doula can help bridge that gap by offering continuous and emotional support and advocacy. Some may prefer that level of support, while others may be just satisfied with having their medical care team. It's up to you. But if you're someone who needs to be or prefers to be connected to your care team, a doula can help ensure that that happens for you. I think
Thank you, thank you.
that's a lot.
Thank you, Amina. We're going to come back to you because mental health is so important, and so we'll come back to you. I want to hear about giving baby human milk. So, Leslie, please introduce yourself and talk about the importance of lactation.
Good evening, everyone. I'm so glad that you're here and to share the stage here with these amazing colleagues. Um, Basically, I like to be the person who bridges the gap in between sometimes the medical and the non-medical. And because there is a gap there, and if we could make a bridge there to where we can all work together and we can have the discernment to know when certain medical interventions are necessary and some are not, then it could just be a beautiful thing. And when it comes to human milk, of course, it would be wonderful for all babies to have human milk in some form, whether that's breastfeeding, whether that's pumping, which is also breastfeeding in a different way. But that really starts with prenatally, because I think there's kind of a misconception that as a lactation consultant that we're kind of like we just latch babies. We just put the baby on and we just cheer, we just cheer you on. But there's really so much more to it. And we really are experts in initiating breastfeeding and maintaining your milk supply and troubleshooting problems that come along the way. but all that really starts prenatally. Everything about your whole birth experience, your whole birth team, it all starts with building that team prenatally. And if you meet with someone in the lactation field prenatally, you're going to have a rapport with that person. They're going to be able, you're going to get the education you need to start things off on the right foot. You're going to have a rapport and be able to have that person you can reach out to anytime. And there you have that comfort level. So then, I'm going to just come into your room or come into your home and you never see me before. I'm just like, here, let me get up in there and help you feed your baby. It's so much better when we've already met each other. We already have that rapport. And I love meeting moms prenatally because we just established that relationship. But I can come in there at any time, but I really enjoy the most whenever I can get to someone prenatally because I feel like by the time you deliver, by the time you have your baby, you birth your baby, that it's kind of like not really the time to make the decision of whether or not you're going to breastfeed. The time to make that decision is prenatally. So I want to reach people and I want other birth workers to reach people when they're pregnant so we can say like, hey, yes, like I want to breastfeed. And you can kind of tell when you ask a pregnant person, like, are you going to breastfeed or how are you going to feed? And they're like, no, like, oh no, like I'm going to try. But like, you can tell that those seeds have been planted. That it's just like they've already kind of planted that seed. Like, I'm gonna try it, but like I'm probably not gonna do it. So I want to reach and provide an education so that an informed decision is made instead of an uninformed decision because there's so much stuff out there. There's so much heavy baggage out there about breastfeeding, myths even that about breastfeeding and about how hard it is or how most people are going to tell you what something negative about it if you just mention it because they're carrying their own, their own story. And so that's why you need people in your corner who can just give you like unbiased facts and can give you all the information you need that if the other people are telling you the negative things would have had that information, their journey probably would have been different. So I want to set you up to be successful from day one and to have realistic expectations and to be able to breastfeed and reach whatever your goals are. Like I think people should breastfeed for years, but that might not be your goal or your story. I just want to support whatever it is, whether you want to give your baby milk for a day, a week, a month, a year, 5 years, whatever it is for you. I'm there for it, and I'm there to help navigate all the problems along the way, going back to work, all those obstacles. I can help navigate, and I just love to be a part of it. So that's pretty much
Oh, Leslie,
my
please tell us the benefits.
benefits of breastfeeding.
Mhm.
We lifelong benefits that are unmatched for mom and baby, and you don't let formula companies tell you that this is closest thing to breast milk because that's just marketing gimmicks. Like there's nothing that could ever match breast milk. It's a live substance. And but like just starting out, it has lots of immune benefits for a baby. They have lower ear infections, lower risk of allergies, lower respiratory issues. Moms have lower risk of breast cancer. Like we've all been impacted by that most of the time in our families. Lower risk of ovarian cancer, lower risk of like heart disease, diabetes, all these things that plague our communities. Imagine if a whole generation, if we raise the rates of breastfeeding and a whole generation is is mostly breastfed, like what will the next generation look like? What will our overall health look like when the next generation comes around? Because I feel like there's a whole generation there that really wasn't breastfed, and all the health issues that are out there and some of even the autoimmune things and stuff, I suspect that some of it has to do with we just had a whole generation of people that didn't get human milk. And
Wow.
of course there's the bond and all that. Like the bond is a beautiful thing. Like that's something that's just precious is the bond. And it really does help to bond with your baby and your baby to bond with you. And it's just one of my favorite things about having any of my babies was the whole breastfeeding relationship and breastfeeding journey.
I'm really, I really hope that the audience takes home that message of the health benefits, especially. And then, of course, there's the lower cost
Oh
of
yes.
feeding the
Yes,
baby.
it is.
It's
And
just, I mean, I remember it like like yesterday, and it was 50 years ago when I had my first child. And I just thought, this is the easiest thing. You know, I was feeding the baby on the subway. I would be feeding the baby as I went through the turnstile. I mean, anyway, you can tell I'm a fan of
Yes.
breastfeeding. Pumping, lactation is so. It also helps you lose weight, doesn't it? Is that
It
true?
It
does.
usually does. You know, for the most part, you do burn more calories. Not everyone
Mhm.
isn't lucky. Some people kind of hold on to a little weight while they're nursing. I was one of those unlucky people. But, for the most part, you do burn a lot of extra calories, just
Mhm.
what your body's doing a whole job making milk,
Mhm.
And it's funny what you said about the cost, because yes, when I had my first child, my teenager, I was like, I knew I wanted to breastfeed, but it wasn't that important to me. I wasn't like so passionate about it or such an advocate like I am now. And it was really, it was my motivator was the cost. It's like, I'm not buying formula, that's too expensive, right? And then, full circle, I kind of like, I've become like this huge advocate for like, everyone must have human milk, all babies must get human milk.
Also, there's the benefit, especially right after birth, of when you put the baby to the breast, it makes your body release something called oxytocin, which helps
Mhm.
contract the uterus and decrease the amount of bleeding that women have after their delivery. So
Yes,
that's another
absolutely.
absolutely important,
Mhm.
essential kind of
Yeah.
reason to breastfeed immediately after birth.
Absolutely. And that skin to skin contact also stabilizes the baby, their blood
Yes,
sugar, their temperature,
that's right.
their heart rate. So that's just a beautiful thing, the way nature works that way.
Yes,
And the colostrum, that initial colostrum they get, it just kind of primes the gut. It like sets the tone for feeding later. It has like a laxative effect that helps them pass the meconium out, that first stool that baby has, and just primes them to tolerate feedings better as that milk volume increases.
They get a lot it's like they're getting a vaccination because if
yes,
the mother has antibodies to things, those antibodies that help prevent infection are passed to the
mhm,
baby in that first milk, right? The first milk that's very concentrated.
Mhm.
Yeah, so
Mhm.
there's a lot of you could
lot of
have a
benefits.
whole program. You could have a whole program on lactation, couldn't you?
Exactly.
Yeah, yeah.
Yeah.
But I do
And
want
there's
to make
definitely a
sure that
reason. I'm sorry,
so
guys.
I wanted to make sure that we came back to the topic of because I think it's something like, and you could correct me if I'm wrong, Amina, something like 20% of mothers have postpartum depression or other mood disorders. So it's important to destigmatize that issue and mention the perinatal therapy and psychological support. And so, would you speak to that a little bit, Amina, please, and tell your
Absolutely.
role in that?
Absolutely, for sure. Because that's how I got here as a doula. I was practicing as a clinician and um, noticed eventually that all of my clients were women. All of them were women of color, predominantly Black women, and everyone was in that perinatal age or childbearing age, right? And coming in with their own individual complications that was around their motherhood, their womanhood, all of that stuff. And so I'm so glad you mentioned about the fact that, about mental health and the stigma, because in all of the training that I had, going through grad school, I felt so ill-equipped. Once I realized what I was seeing, I felt so ill-equipped to work with that particular population. It just it, just knowing what I knew as a psychotherapist, being psychoanalytically trained, understanding the direct connection between psychological stress and harm and the physical body. Um, and the woman is carrying the baby who's feeling all of her stress and her anxiety and her happy times too. So I came to become a doula after I Googled maternal mental health, first aid. I was looking for some first aid information on how to recognize signs and symptoms. How do I notice when I'm dealing with some symptoms of depression or anxiety that's just onset during this period compared to maybe this is what she brought in with her prior to. And so I'm here and I'm doing this work, and I champion maternal wellness, maternal mental wellness, because I believe in that trifecta, healing the mind, the body, and the soul. And I strongly believe that without addressing all three together holistically, our bodies will always be at some sort of dis-ease, right? Some sort of dis-ease if we're just only targeting one or two and not the others. And so as far as mental health is concerned, right, we're aware, I'm hoping we're aware at this point that there are preventable reasons for maternal mortality and morbidity. And mental health is one of the top leading reasons, preventable reasons for maternal mortality and morbidity. And what I've come to realize is that as women, as Black women, and just the culture in the US, in the US, um, we tend to suffer in silence. We're feeling depressed, we're anxious, we're scared, we're having thoughts that scare us. But because there's the stigma that comes with mental illness, we tend to suffer in silence. And when we don't tell our stories about what we're dealing with, it's hard for others to help, right? If we're not saying these things out loud, we're not able to get the help that we rightfully deserve. And so you're right. Around about that is the numbers of women who are dealing with perinatal mood and anxiety disorders. And that covers depression, anxiety, bipolar disorder, right? And other mood disorders. That covers postpartum psychosis, and OCD, anxiety disorders such as postpartum OCD. And so I think it's really important. I know it's really important to get mental health care, but if you're considering birthing, if you're considering going on this transformative life, I highly recommend seeking mental health care as soon as you know that this is the journey that you want to be on, if you're not already under the treatment of a clinician or a psychiatrist. Get the help, because one thing about trauma survivors, it's trauma is a funny thing, right? Trauma is sometimes we don't even consciously, we may not have realized that we've been traumatized, but our body holds on to that trauma. And so pregnancy and birthing has a very interesting way of bringing those traumas to the surface, and our bodies will respond and react in those ways. The way you interact with your care team can be directly related to your trauma history. And so it's really an important piece of your care, not just your physical care, but for your mental health care, for you to also include mental health treatment in your journey. You're muted.
That brings me to a question in the Q&A that I want to share with all of you. What advice would you give women who are planning a pregnancy or currently pregnant that are having difficulties advocating for a holistic care plan amongst their care team? Specifically, how to deal with a situation the providers are not empathic and active listening. Oh, you need a midwife. I think that's a question for you, Janet.
Okay. First of all, I'll say when you're considering a pregnancy, my best advice is to plan ahead. Even if you start before you're even pregnant, make an appointment for a preconception visit with your provider, get your checkups, talk about medications that you're on to make sure that they are okay if you become pregnant on those medications. If you don't routinely take women's vitamins, start taking a vitamin that has folic acid to help prevent any birth defects. Usually by the time a woman finds out she's pregnant, the baby's organs are already being formed. So it's important to be on a good vitamin with folic acid even prior to a pregnancy. You want to make sure your vaccinations are up to date, all of that. That's to be in the healthiest state to ensure that any disease or disorder that you might have before is well controlled, such as diabetes, asthma, anemia. Okay, so then we say, what do you want your birth plan to look like? Like, what is your dream of a birth? So the first thing I'll say is important to understand that not every birthing person can deliver at home or in a hospital or in a birthing center. It depends on your health status. And it's also important to realize that there are not nearly enough birth centers at this point or available midwives in the U.S. to accommodate the need of all the women that have that desire. So depending where you live, that can dictate what provider is even available to you. So in some areas of the country, they've closed so many hospitals and they've created what we call maternity desert, which affects the proximity of where the hospitals are, if there are birthing centers there, and how many midwives are around. So the first thing I'll say is seek prenatal care early, and you want to interview. This is very important. I'm going to say you want to interview your providers. When we want to buy a car, when we want to get a gym membership, when we want to go on vacation or stay at a hotel, we are so good at getting on this computer and really researching all of the benefits of different places, different people that we're going to hire. The same goes for your provider of care. That is so important. So you want to talk, you want to visit a midwife if you want a midwife, or OBGYN if you want an OBGYN. That's perfectly fine. You want to go, you want to find out what is their philosophy on pregnancy and birth and see if it aligns with yours. If you have someone, you can ask them, what is your C-section rate? If someone has a 50% C-section rate, that already told you a story, okay? You want to look for providers who are knowledgeable and seem sensitive to your unique needs and concerns. You want to ask them to explain to me what informed decision making looks like to you. You can ask your provider that, and discuss possible contingency plans when meeting with your provider. If you have what your birth plan in your very general kind of generalized birth plan, if you have that and you share it with your provider, ask them about possible contingency. Like, tell me some things that could happen that would make you want to change my birth plan, and see how they explain it to you. If you don't connect with your provider or you fail to speak up, it can lead to a lot of problems. It can lead to misinformation. It leads also to birthing people not giving us a full history, which is so important when we're taking care of you. So the bottom line is you have to trust your birth provider. And if you go to one and you find out that it's not aligning with your needs, or you're not feeling comfortable, start early. You want to change and find that provider that makes you the most comfortable as soon as possible. You don't want to wait till the end of pregnancy and just kind of go to delivery not feeling comfortable. You want to find someone you feel comfortable with, they listen to you, that you feel respected, you feel heard, you feel cared about, you feel safe. I guess that's the thing. You feel safe. You feel like they're giving you the information that you need to make decisions. And if you don't understand the information they give you, that you feel comfortable saying, I didn't understand, could you explain it again? And they'll sit with you and explain it over and over and get you resources and send you to a lactation consultant, for instance, or they'll send you to the licensed therapist, or they'll send you, to, and I also used to invite, if a woman had a doula, have your doula come to your prenatal visits. That way they're hearing the same information I'm giving you. They're hearing it. They can help reinforce anything. They can help you ask questions, or later when you say, I didn't remember what she said, you have another set of ears, the doula and your partner, for instance. So I think it's so important that we need to make sure that we are really connecting with that provider. I think that's the most important thing. And again, I think that women should ask for midwives. I think we give wonderful holistic care, but like I said, they're not everywhere. So a lot of training needs to be changed in the medical education system so that more doctors are trained to a holistic way of caring for women.
So what we're talking about is person-centered care.
Person-centered care.
That means that the care that the provider, the doctor, the nurse, the midwife, they're providing care that is in line with your preferences, needs, and values. That's person-centered care.
Gotcha.
Doctors are not really trained in that way. Nurses and midwives are. Unfortunately, around 100 years ago, doctors and hospitals decided that they wanted to be in charge of birth, and now that we some people do need C-sections, etc. So we need doctors for the high risk situations where you might need a C-section, but you really need the care of someone like a midwife, of the care that like a midwife would provide. And you can sometimes get that with your doctor. And that is by first making that relationship a partnership. Do they look you in the eye? The body language is so important. So you've got to be able to ask your questions and feel like they're really communicating with you, not looking at the door, not looking at their phone, looking at the computer. So you want to, and if they aren't giving you eye contact, if you don't feel comfortable, say, "Doc, is everything all right? I'm feeling some kind of way here. I just want to make sure I have your attention because this pregnancy is so important to me." So you want to have that kind of conversation. We have a program called the ACT curriculum and ACT, and this is to help us with communicating with the providers. Since we don't always have a Dr. Janet Williams midwife available, we got to figure out how we can have those almost intimate conversations and develop that bedside manner that you want to have by saying things like, in our ACT curriculum, we say, ask questions until you understand the answers. Claim your space, both physical and mental. That's your bodily autonomy and your dignity and self-determination. Trust your body. There's 2 T's in ACT. Trust your body and tell your story. Don't dismiss your symptoms. If the provider or the doctor, midwife, whoever it is, nurse, is dismissing what you feel in your body, you know your body best, then make sure that you tell your story, get some help telling your story, have your doula with you. Your doula is they are your support, your emotional support, your physical comfort, your informational support. They also help you advocate for yourself. And your partner can also be equipped to do those things for you too. If you do your childbirth classes and go to the website where ACT is there, you'll find lots of questions that you and your partner, your family members, your mother, whoever's with you can remember to ask and feel like you are in the driver's seat of your care. So I just wanted to make that little speech. Did I miss anything, Janet? Amina?
Nope.
I'd like to add some things, right? Just
Sure.
in my experience as a doula, oftentimes it can be really challenging for individuals to assert themselves and feel comfortable, right? Many doctors have very peculiar ways of approaching and just working and communicating that can be very dismissive and just overlooking concerns, right? And so it can be really challenging, particularly because that relationships, the dynamics, the hierarchy, right, can be intimidating. So you do have a right to respectful care. You do have a right to advocate for you and your baby. What I would recommend is for you to trust your instincts and stay informed, right, by educating yourself on the childbirth process and educating yourself on the information that the doctor is giving to you. So in the event that you can't change your provider, because you can change your provider if you don't feel safe, if you don't feel like you can trust that this doctor has your preferences and respectful care as priority, change your providers. But as Janet mentioned, there are some areas that are deserts, right? Provider deserts. So luckily we're in the age of technology and the internet, I would also recommend seeking support outside of your care team. Look for an additional support and resource outside of your doctor's office, like online forums, support groups. Even visit some holistic healthcare practitioners who specialize in pregnancy and care. Connecting with others who share your values and experiences that can provide some validation and some encouragement. So also bring a support person with you to your doctor's appointment. I know I have some aunties who are very vocal, who are not shy, who are unapologetic about the things that are in their head. Maybe you might need to bring that auntie with you to help be that support and help get your voice heard to your doctor. And always document your concerns. Keep a record of your concerns, keep a journal so that this documentation can be helpful if you need to escalate your concerns or seek support from a higher authority. Because if you don't get your questions answered through your doctor, through your nurse, I encourage you to climb the ladder of the chain of command until you get the treatment and the care that you deserve.
Definitely, definitely. And I want to go to Christy B's question. As a doula and community health worker in maternal infant health, how can I push this more without overstepping boundaries in hospitals, but also getting clients to really understand how to advocate for self? And so the overstepping boundaries, how can I push this more without overstepping boundaries in hospitals? So for getting clients to really understand how to advocate for self, I do, it's I think they call it a shameless plug to say, go to the Black Coalition for Safe Motherhood website and look at some of the tips and tools for advocating. Use that toolkit. We got a lot of different things that people have contributed. And then it's important to know that you have a right to get the care that the quality care that everyone deserves. So I wouldn't be worried about overstepping boundaries in hospitals. I would try to, if someone who's, I would try to make alliances with the people at the hospital that have some power. Get to know the who's friendly, who wants to make sure that there's respectful care in your hospital, and have those names available. Get in touch with the person who's in charge with quality and safety. One of the things that people can say if they don't like the way they're being treated is say, I don't feel safe in this hospital because this or because that, and because they're really concerned about patient safety these days. So you can use buzzwords like that. Say, I don't feel safe because you're not listening to me. But can you listen to me? Would you want this treatment if I was your daughter or your sister? So you want to let them know that that they're not treating you properly, and you want something done about it, and have the names of the higher ups that have some power. Get to know the names of the people in higher ups in the department of whatever department you're talking about, OBGYN. I'd like to speak to the department chairman, and have the name of that person, or who's in charge of nursing. I'd like to speak to the nursing supervisor. If you have concerns, you're entitled to get the proper care. And if they're too busy or whatever it is they are, you want to start going over people's heads. So anything else to add? Anybody else?
I'll just to say overstep. Can you repeat the way she put the question as far as overstepping?
As a doula and community health worker, how can I push this more without overstepping boundaries in hospitals?
Okay.
But
I just have one example. I know when we first started getting doulas in my facility, we had, I'll just say it was just really one person that was doing this. And she would have a plan of care with the patient would have a plan of care, and they would come in and the patient would be in labor. But during labor, like I said, that plan of care can change. And it can be changed sometimes because the provider feels that it needs to be changed, but we'll explain we need to be very clear and explain why we feel it should be changed. And in the end, after we explain everything, that patient still has the right to have what she wants. But what we noticed with this particular doula, and it was just one, when the patient started to change the plan of care, the doula was kind of kept going back to the original plan of care. And it got to a point where the staff had to almost step in and say, no, the patient is now saying this. I know this is what the original plan was, but now the patient wants this. It had something to do with the patient decided she wanted an epidural. And it was almost like the doula was trying to talk her out of it because their long-term plan before had been no, she wanted to go completely natural with no pain medicine. But during labor, that changed. So at that point, we felt she was kind of overstepping, and it was more that we spoke to the patient and said, "Your voice is what we're listening to. We know you have a doula, but you have to be the one to decide what you want, and we're going to go with whatever you want. You have to. It's two different voices. We have to still go by what the patient wants in the end. So that was the only time I could see something like that happening where it was kind of almost overstepping.
Hopefully we answered Christy B's question.
Can I
And
can I share what works for me as a doula, right?
Mhm.
Because you're right. It's I go off on doctors, right? I'm not anti them, but but it can be really frustrating and stressful to see stuff happening. And so one thing to be mindful of is as a doula, as a family member, as a support person, right? We're there to raise their voice. So I might want something, or I may have preferred things to go one way, right? But it's really important to leverage the voice of the mother.
Right.
But in doing that, what works for me is empowering the mother with knowledge, with information, with education about what their options are, um, what their rights are, what they're entitled to, right? And
the risks and the
the risk-
benefits.
the risks and
Correct.
the benefits, right? Letting them know, just giving them a summary that they have a right to informed consent. They have a right to withdraw consent at any time
Yes.
during their
Anytime.
procedures, right? They have a right to refuse treatment, right to having additional support. And by providing that education during the prenatal process, for me, has been a game changer in allowing the mother to be able to make those sound decisions when everything starts to pick up and become extremely intense. Knowledge is power, knowledge is
Yeah.
empowering. And just by knowing your rights, you can outsmart the doctor, right? Like that's what I like to do, just outsmart the doctor by what I know and by sharing that with the patient and allowing them to make decisions based on the information that they receive.
And if they're pressuring you, if you're in labor or wherever the case may be, you just want to buy time by saying things like, would you give us some time, some space to, so we can pray on that? Or we need to discuss this further, or we need more information, or, there's ways of saying, you don't even have to say no. You can just put them off. If you don't want to do something, say, I haven't made a decision about that yet. I'm still thinking about that. So there's many ways to navigate these pressurized situations. But remember, it's your body, and you know best what's best for you. The doctor is not the boss of you, regardless of this hierarchical system that they are raised up in. So, and I, for example, if the doctor calls you by your first name, I would call them by their first name. That's just an example of trying to get rid of that hierarchy. That power differential is dangerous. We need good communication. If you don't have good communication, you do not have safe care. So we cannot be living in a situation or having giving care in a situation where there's these hierarchies and power over. So I'm just rambling now. What else? Any other questions?
I also would like to add too, right? Because when we're giving birth in the hospital, we're basically in their land, right? We're in their domain. And so the hospitals, they have their purposes, they have their processes, they have their protocols. So oftentimes their approach is based on their training and based on policies and procedures, right? Liabilities, insurances. So sometimes what doesn't make sense to us, such as needing to lay on your back the entire time because you have an epidural in your back. And we as doulas and midwives, we know that that's kind of like counterproductive to the process happening, right? But once you get the epidural, you have to be on your back because for the hospital and liability insurance purposes, you have to be on your back. And as a doula, because this
Not in your back, not on your back, but in the
Not
in
on
back.
the
your back,
bed,
on the
right, in
side.
the
Yes,
bed,
okay.
right? So you won't be able to move around, you won't be able to walk around, you just have to stay in the bed. And as a
Right.
doula, that's although it grinds my gears, I know
Mhm.
that that's a decision that the mother has made, and because this is the hospital's territory, that's
Right.
something we have to sort of step back on. That's a fight, that's a battle that I have to choose to back away from.
Right.
Which is why we need more birth centers and more midwives so that some who are low risk, don't have any medical conditions, could give birth outside of the hospital.
Yeah.
I'm so sorry, we are at time. The time just flew. We have another program coming up in just a minute called Bump Friendly Beauty, Navigating Pregnancy with Natural Products. Oh, it's coming up at 8:30, so we have a little
Oh, we
time.
got a few minutes. Okay.
And so we have a message in the chat about that last bit, which is why we need more conversation around the pros and cons of getting an epidural. So that's in the chat, and yes, I agree. And inducing labor also. There
Because
should
that
be
goes hand in hand with the
goes
epidural.
in hand with that. Yes,
Exactly. Exactly.
there's a lot of potential problems that comes with inducing labor. We didn't get to talk about it, but I'm going to put in the chat a tool that you can use. Look at partner to decide has a great tool that you can use with your provider to make sure that, do I really need to be induced or not? And that's something that you can use. It's a tool you can use. There's more and more decision aids that we can use to get the care that's in line with our values. Thank you, everyone. I think we're going to just turn off automatically at like pumpkins at midnight. It's 8 o'clock. I don't know what happens. Marie, can everyone give their final thoughts, or do we have to go off?
I know we've got the 30-minute break, and then don't forget, we are going to talk about, I feel like that guy that used to do that show. What was the show where he talked with Regis Philbin? Nobody's probably that old. He talked, but no one ever saw him.
Oh, behind the screen? That's you, yes.
But I want to remind everyone that if you want it, the whole conversation around inductions and C-sections, we have a workshop for that on Monday at 6 p.m. Eastern. It's called Options and Opinions,
Excellent.
Informed Labor and Birth, with a brilliant obstetrician, a nurse. I think we've got a midwife who's joining the conversation, and it will be hosted by Dr. Leslie.
Okay.
And so join us for that conversation. And no, you guys please do a final thoughts. We've got a little bit of time.
And Patrice Antoine said, how does she sign up? But I think
I will drop it in the chat, Patrice, right this moment. Thank you.
Oh, okay, final thoughts.
Or mine would also just be where we started talking about the induction and the epidural is it's pertaining to lactation is your birthing experience also affects your breastfeeding experience. So
Yes,
it's part of a chain reaction. So if you go through the induction, you go through the epidural, like all those things, they affect breastfeeding in the long run. So it's so important and it all goes hand in hand. So prenatal
Amen. If you,
education all the way around.
yes, you want to try to avoid having a traumatic experience in your birth by being well informed throughout the whole process and comfortable with the decisions. Like they say, no decision about me without me.
There
Amina?
you go.
So what I would say is we need more midwives, we need more Black midwives, we need better legislation around home births and birthing centers, because hospitals should not and is not our only option to give birth. Midwives have been birthing this country since before hospitals were in existence. And so I dream of the day when we are able to give detach from our allegiance to the hospitals. Don't get me wrong, hospitals serve a purpose, right? When we need surgery done, if an emergency, if it's medical emergencies, we can use them. But if you're healthy and if you're well, the baby is well, you don't need to go to the hospital to give birth. That's all I would say.
Amen. Janet?
Yes, my takeaway is that when providers, regardless of their title, focus on connecting with women, respecting their voices, communicating effectively, they help the birthing person and their partners feel safe, empowered, supported, heard, and cared for. And that is no matter what setting they're in that we people find themselves in. That is the bottom line. Birth should be joyful, and like she said, we need to recruit more midwives, doulas, lactation. I think we need more people in birth work careers, and those careers are. I don't hear them discussed that often when you go, to different places, career fairs. So I think it's a calling, it's hard work, it's an art, it's a science, but it's not for everyone. And we should have information though about all of these different careers, even if someone's not interested in going into the career, they need to be knowledgeable about what's available to their family, friends, and their community.
Thank you. Thank you, everyone. And the most important thing is get educated about your health, about your pregnancy, the birth that you desire, do your childbirth classes, and make sure your voice is heard. Thank you so much.
Take care, everyone.
Bye.
Bye-bye.
Bye.